Right. Hey, everybody. We are beginning Unit 13 today. So, Unit 12, we talked about the different types of abnormal behavior, right? How to classify different disorders. This unit is, built right on top of that because it's about the treatment of abnormal behavior. So, how do we treat? What are the different approaches to treating the abnormal behavior that we studied in Unit 12? So you notice it's a pretty short unit. It's only 4 lessons, right? So this will take us to next week, but that's it. Um, so today we're going to talk about a little introduction to therapy, what therapy is. We'll talk about the psychodynamic and humanistic therapies, right? We talked about those approaches to psychology already, so you shouldn't be surprised by a lot of the stuff, a lot of the methods they use in order to conduct therapy. Tomorrow, or I guess the next day, right? We'll be looking at behavior, cognitive, and group therapies. Then we'll evaluate the different psychotherapies. We'll talk about prevention strategies, so before a problem occurs. And then we'll conclude with the biomedical therapies, so drug treatments, right? Okay, so today we're looking at it's an introduction, right? What is psychotherapy, biomedical therapy? And what's an eclectic approach? This is going to be important because most therapists use an eclectic approach. So make sure you know what that is by the end of this lesson. Then we're going to go over the goals and techniques of psychoanalysis and how they have been adapted in the psychodynamic approach. Remember that psychoanalysis, that's Freud, right? That's Freud's method. And the psychodynamic approach is basically the people that came after Freud. They took a lot of his ideas, but got rid of some of the other stuff, like the psychosexual stages, among other things. Um, and then finally, we'll look at humanistic therapies. We'll talk about Carl Rogers, right? His client-centered approach. We've mentioned Carl Rogers before, right? Remember, humanistic therapies or the humanistic approach to psychology is right that all about self-actualization, right? It's focusing on improving rather than fixing problems, right? So, like, how can I be my best self? All right, so let's get started. So how does psychotherapy, biomedical therapy, and an eclectic approach to therapy differ? So, psychotherapy, right? You have a trained therapist, uses psychological techniques to help somebody get over a problem or achieve personal growth. It's all of these psychotherapies are going to be built on one of the major theories, right? So psychodynamic, humanistic, behavioral, cognitive. There's more, but these are the most influential ones and the ones we're going to focus on. The biomedical therapies, right? Those are, like I said a minute ago, that's medication or other biological treatments, right? We'll look at those more in depth on the last lesson in this unit. Right, so an eclectic approach, which is most therapists use an eclectic approach, it's basically a blend, right? You take parts of different methods and combine them. So most psychologists or therapists today use an eclectic approach of multiple different types of therapy in a way that hopefully best benefits their client. Okay. Right. Most patients receive some kind of psychotherapy combined with medication, and studies show for most disorders, for most problems, that's the best approach. Right. A combination of medication with psychotherapy, whereas one by themselves is not as good, not as efficient. All right. So psychoanalysis and psychodynamic therapy. We want to look at the goals and techniques, right? So Sigmund Freud, right? That's psychoanalysis. If you see the word psychoanalysis, you should think Sigmund Freud. He came up with the first of psychological therapies, which is the main reason why we still talk about it. So his goals, right? He presumed that healthier, less anxious people or living becomes possible when you release the energy that was devoted to the conflicts between the id, ego, and superego, right? Real quick review. Right, the id is like our unconscious wants and desires that we're too afraid to like say out loud. The superego is kind of like your conscience. It's like your ideal self, and the ego is like the person or the you that like struggles to find the balance between the id and the superego. Right, the ego is grounded in reality. That's what Freud said, right? So Freud's therapy, the goal is to bring out patients' repressed or disowned feelings into their conscious awareness. Remember, Freud's all about that unconscious, right? He thinks all our problems are something to do with this unconscious fight or struggle between the id, ego, and superego. So about the therapy would involve bringing those to light and basically being like, oh, now I see it, right? Showing people themselves in a way, right? They would call this insight, right? When you give somebody insight into the origins of their disorder, that can help them, overcome the disorder. Also, remember, I'm going fast, but like it's a video, so pause, rewind, do whatever you want to do. Also, the PowerPoint will be uploaded with this video. So, what techniques did Freud use? So, right, hypnosis doesn't work. Okay, so Freud turned to free association. Right, and I think we've talked about this before. This is an example, right? I'm just going to read this. Right, you say aloud whatever comes to mind. At one moment, you're talking about a childhood memory. Then you're describing a dream or a recent experience you had the other day. You might pause for a second before saying something embarrassing, or you might omit something that's trivial, irrelevant, or shameful. You might joke or change the subject while you're doing this. It's kind of like stream of consciousness, right? Freud would say when you joke or change the subject or you omit things that are shameful, that's called resistance. It's like a mental block, right? You're purposely not saying that. And then what the therapist will do, right? So we'll pretend it's Freud, right? What Freud would do is interpret what you're saying, right? Oh, you don't want to talk about your mom? Well, then there's some underlying feelings or wishes or conflicts that you're avoiding between you and your mom, right? You could probably already see, not very scientific, right? It all depends on who your interpreter is, right? Who the therapist is. Maybe you're feeling another thing that happens, according to Freud, is that you experience strong positive or negative feelings for your therapist or your analyst, right? And so maybe you're talking about your dad and you're starting to get angry and then you lash out at your therapist. The therapist would say, oh, you're transferring your feelings onto me, okay? So just through a few vocab words there about from the psychoanalytic perspective of therapy. Right, not supported by scientific research, right? Mostly we talk about Freud because he was the first to kind of like do a lot of things, which is important, more of a history approach than what we use today. Right, in analysis interpretations, they can't be proven or disproven. It's going to be different. One person's interpretation of your not wanting to talk about your mom could be totally different from another person's interpretation. So it's not scientific. Very few therapists use traditional psychoanalysis, if any. Right? I don't know the numbers on that, but it's very. I highly doubt there's any therapist out there that only uses psychoanalysis, right? But there probably is somewhere. Right. So here's a little. Right. You probably all every time you think of therapy, you probably think of right the couch or lying down, the guy with glasses writing on a clipboard or a notepad behind you. This is not how therapy looks, right? Normally, so read this down here, right? You're face to face. You're in a comfortable setting during therapy, but it's not like you're facing away, laying down on a couch, right? That's what everyone. If you were asked to draw it, someone would probably draw this as therapy, but that's not how it is. Okay, so psychodynamic. Right, that coming after psychoanalytic. So we're taking stuff from psychoanalytic tradition, right, like responding to unconscious forces and childhood experiences with the goal of self-insight, right, to enhance, to get the person to see kind of like what's blocking them. It's brief, not that expensive. It's focused on the client, finding relief from current symptoms, rather than digging up the past. It's more about, okay, what's happening right now in your life? Let's focus on that and see what the unconscious forces and childhood experience, but it's less emphasis on the past and more emphasis on current situation, which, you can probably assume is, it would help more, right? Right, it's a psychodynamic therapist would say they're in a position to introduce people to themselves, right? Restoring awareness to their own wishes and feelings, right? So it's like, That's the idea of like pulling out those unconscious things that you're not totally aware of and then showing them to the person. Like, oh, I didn't realize I was thinking like that. I didn't realize, I refuse to think about this person in my life. But it's getting people to see what they're kind of avoiding from dealing with, right? Introducing people to themselves. It could help past relationship troubles. You can look at that and then figure out, oh, I can see that, how that's happening in my current relationship, and then get people to, change the way they're acting in the current relationship. Um, Interpersonal psychotherapy, right? This is a 12 to 16 session variation of the dynamic approach, and it's been shown to effectively treat depression. So it does have its beneficial use, right? Again, it's rather than focusing on undoing the past, it's focusing on current relationships. Okay, that's the difference between the psychodynamic, which is yes, we're going to look at the past a little, but we're also going to really be focused on the now. Whereas psychoanalysis is they just care about the unconscious past, things you've repressed, right? So here, take a minute, right? Pause the video, try to answer these two questions. Seriously, pause the video, right? Just take a few minutes, just try out loud. You don't have to write them down. It'll help, right? Help you remember better. Okay, I'm going to keep going though. Remember, you have control over the speed at which this goes. Humanistic. So we want to know, right, what are the basic themes of humanistic therapy? And we're going to talk about Carl Rogers's client-centered approach. So, right, it's all about self-fulfillment, reaching your potential when we're talking about the humanistic approach. So if we think of psychodynamic and humanistic therapies, they're often called the insight therapies because both of them are trying to get people to like see themselves more clearly or more fully or understand yourself just better. However, there's some very clear ways in which the humanistic approach differs from the psychoanalytic approach. So let's look at those now. So humanistic therapy aims to boost people's self-fulfillment by helping them grow in self-awareness and self-acceptance, right? So a humanistic therapist would say, yeah, you have flaws, so does everybody else. That's fine. Accept them, right? We're going to learn how to accept them. Everybody has flaws. We should be okay with that. But it's hard, so, let's talk through it. It's about growth, not curing illness. If you remember, the humanistic psychologists, they really studied healthy people instead of people with disorders or unhealthy people, quote unquote, whatever that might mean to them at the time. But it's about promoting growth, not curing illness. That's the focus of humanistic therapy. Right? The path to do this is you take responsibility for your feelings and actions rather than uncovering these unconscious things that are out of our possible awareness, right? So it's really about taking responsibility for the way you're feeling and the way you're acting and really critically examining that rather than trying to dig up the unconscious things that are causing those feelings and actions. Just to reiterate that, right? It's about the conscious thoughts. What are you thinking? How are you thinking? How do you feel about yourself? Like, how do you, are you down on yourself? And those are conscious things that happen. So it's humanistic therapies is more conscious thought. Psychodynamic is more unconscious. But both are really getting people to kind of like see themselves. And that's why they're both considered insight therapies. You're trying to give people insight into their own feelings and actions. Different ways, right? Different focuses, conscious versus unconscious, but same kind of end goal. Right, in humanistic therapies, the present and future are way more important than the past. Psychodynamic relies a little bit more on the past, right? You're looking at past things that might impact your current situation, whereas psychoanalytic is like they love the unconscious in the past. And again, that psychoanalytic is not a currently used therapy. So if we're talking about humanistic therapies, we got to talk about Carl Rogers. Okay, he came up with what's called the client-centered approach or the client-centered therapy, which focuses on a person's conscious self-perceptions, right? How do I think of myself day to day? Consciously, not unconsciously, but actually, how do I feel about myself, right? So it's non-directive, which means the therapist listens without judging or interpreting, all right? So Rogers encouraged therapists to exhibit these three things, and you can remember this with the acronym AGE. So acceptance, genuineness, and empathy. We've talked about these before, right? Acceptance, accepting people who they are. Genuineness, probing for more information, being interested in what someone's saying. And empathy is, reflecting someone's emotions or the way someone's feeling. Okay, trying to really feel what they feel. Um, so this is, I think, yeah, this is direct. This is Carl Rogers. This is his words. So I'm going to read it to you because why not? So hearing has consequences. When and this is Carl Rogers speaking, when I truly hear a person and the meanings that are important to him at that moment, hearing is not simply his words, but him. And when I let him know that I have heard his own private personal meanings, many things happen. There's first of all, a grateful look. He feels released, like someone's heard him. He wants to tell me more about his world. He surges forth in a new sense of freedom. He becomes more open to the process of change. I have often noticed that the more deeply I hear the meanings of the person, the more there is that happens. Almost always, when a person realizes he has been deeply heard, his eyes moisten, right? Get a little emotional. I think in some real sense he is weeping for joy. It is as though he were saying, thank God somebody heard me, somebody knows what it's like to be me. Okay? So when Carl Rogers says hearing, he's talking about active listening, which is something you've probably heard before. I know I've talked about it before. And this is, echoing is not the best word, restating, right? Seeking clarification of what the person expresses, verbally or non-verbally, right? Look at body language, where their eyes are looking, all that, those non-verbal gestures, and acknowledging the actual expressed feelings, right? The things that are being said. So here's a little interaction between Rogers and a client. So Rogers says, feeling that now, right? Or that you're just no good to yourself, no good to anybody. Right here, he's paraphrasing, right? Never will be any good to anybody. Just that you're completely worthless, right? Huh? Those really are lousy feelings. Just feel like you're no good at all, right? So he's like paraphrasing, but also clarifying, right? And the client would be like, yeah, muttering, low, discouraged voice. That's what this guy I went to town with just the other day told me. Rogers say, well, that guy you went to town with really told you were no good? Is that what you're saying? Did I get that right? Yeah, that's what he said, right? Mm-hmm. Rogers goes, well, I guess the meaning of that, if I get it right, is that here's somebody that meant something to you, and what does he think of you? Well, he's told you that he thinks you're no good at all. And that just really knocks the props out from under you, right? Client, I guess, begins to weep. It just brings the tears. Some silence. Client says defiantly, I don't care, though. And Rogers would say, well, you tell yourself you don't care, but somehow, I guess some part of you cares because you weep over it. Right? So you can see that Rogers is really trying to hear this guy out, and it's about getting them to see themselves. Right? That's what the goal is, but he's doing that through this unconditional positive regard, through this acceptance, this genuineness, this empathy. And this is that client-centered approach that Rogers was talking about. Right? So you give that non-judgmental, grace-filled environment. That unconditional positive regard is key. That's accepting people at their worst, even their worst traits, to make them feel value and whole, right? So if you want to actively listen in your own relationships, right, which is never going to hurt, and it is active, right? You have to do it. You can't it's not passive, it's active. Here are some hints that may help. So paraphrase. Rather than saying, oh, I know how you feel. Oh, I've done that. I've been through that. Don't say that. Nobody wants to hear that, right? Check your understanding by summarizing in your own words what the person said. That's what paraphrasing, right? Paraphrase, not parrot phrase. You're not just saying back the exact thing they said. You're putting it in your own words. So it's also clarifying, right? So you want to invite that clarification. So, is there an example of that? You said they put you down. How did they put you down? Like, invite clarification, ask clarifying questions, encourage the person to say more. And then reflect feelings, right? That's that empathy piece. Wow, that sounds frustrating. Or like, that sucks, And sometimes it's all people need to hear, right? It might mirror what you're sensing, right? The person might not say, I was really frustrated. They might be active. Just you can just tell it's in their voice that they're frustrated, and just by saying, "Wow, that sounds frustrating," it helps somebody feel heard. Um, so that's kind of the humanistic approach, right? This unconditional positive regard. So go ahead, check your understanding here. Make sure you can answer those 2 questions. Um, right? You can pause the video, try that. And then some FRQs, right? If you can answer these, you're golden. Uh, Again, depending on when you do this, right, we can talk about it. I guess for you it'd be, today at noon or the following day. So if you have a question about one of the, check for understanding or FRQs, bring it to the Zoom meeting. Okay, and speaking of Zoom meeting, I'm recording this and it is 12:03, so I'm late for the Zoom meeting that we have right now. So I'm going to end this video right now. Okay.